Good afternoon, everybody. It's 12:45, the end of our Ask Me Anything hour, so I'm going to answer a few questions today. I got 5 questions to finish up the questions about hormones from the lecture we did with Dr. Schipple at 4-Day Weekend. And I have one big question about diabetes, and that's about all we're going to have time for today. I'm going to actually start with diabetes because the question is about someone's dad. They have heart disease, diabetes, overweight, not compliant with the diet, and suffering with medication side effects. And you know, the thing is, a lot of people just don't really understand this, and this is a great opportunity to start educating people what is going on and what is causing this. And they're also a super picky eater, so of course this is a challenge. And I really want people to understand that there's so many levels to education and understanding about your health, and we want to make sure that we're reaching everybody. But the most important thing that I want people to understand is there is this unbelievably wonderful study called the EPIC study, where they found that 93% of the diabetes would have been corrected if people did 4 things. And one of those things was eating a whole food plant-based diet. And I want to go into that a little bit more. A lot of times people don't realize that they're eating way more sugar and carbs than they realize. And if someone had zero knowledge about this and I was going to start working with them, I would probably want to be realistic and try to help them find ways to reduce it first and get in the practice of it, because this is a lifestyle change and that is not something to be easily done. You can't just tell somebody you have to stop eating sugar and stop eating carbs and go into this type of diet, because it's not realistic and obviously it's not been working so far. So my advice for someone who's just baby stepping into it is, first of all, just kind of be conscious, be aware of how much sugar is coming into your diet. And the number one thing I would really try to remove or reduce as much as possible would be the liquid sugars. People have no idea how much sugar that they're drinking in juices, in sweet tea, in their coffee when they're putting sweetener in there. When you start to add that up, you're going to find out that most of the time people are taking in way more sugar than is healthy. Way more than MD Anderson and Mayo Clinic and the World Health Organization agree is the limit. And again, that's 25 grams for someone with a normal BMI. So if you're way above that, then that's where your first focus is going to be on your target, is reducing the excess sugars, of course. Now, that can be difficult. I've had friends who said, hey Dustin, I tried to get under 25, couldn't do it. So you know what I told them? Try 35. Start there. You have to start where it's going to work for you. Otherwise, you're just going to give up like my friend was going to give up. So really find that. So that would be number one, is identify where you may be getting excess added sugars. And the other thing would be looking at where you're getting too much carbohydrate intake. And that's probably across the board for anybody who's having that. So I would start with breakfast with that person. And if I'm going to try to make it as easy as possible, I would encourage them to go with eggs for breakfast, or avocado and eggs. I know that these are whole foods and they may be way out of sight for you, and you may be used to eating cereal for breakfast or pancakes, or just have to have some type of carbohydrate. I would encourage you to go for other breakfast options that are going to be more protein and fat based. Of course, raw nuts and seeds are going to be a huge recommendation. Try to get those into your life and see if there's one that you can snack on that will be good for you, because that is going to be a healthy fat and fiber. And again, one of the main things that I tell almost everybody, if you're going to try to make a transition in your diet, is to incorporate a little more beans into your life. You need the fiber, you need the magnesium, you need the potassium, you need all of those nutrients that are going to be in beans. Now, if that's still out there for you, for those of you who are just starting, start where you can start. Start with 1 day a week. Start with 1 day a week trying to make those changes and just see how it goes. Don't give up if it's hard. Try again next week. Try a couple of days a week. Start where you are and start moving forward. But reduce the carbohydrates as much as possible. When I mean carbohydrates, I don't mean vegetables. You definitely need to eat more vegetables. I'm talking about refined carbohydrates, so your breads, your any type of tortillas or baked goods, anything that's going to have some type of bread type substance to it is going to be what we're going to try to be aware of. First of all, be aware of it, and then see if you can reduce it, even if it's just 1 day a week to start. Now, I've been yelled at before by medical professionals saying, you can't tell people it's okay to eat sugar if they have diabetes, and I'm not saying it's okay, but I'm saying that if you tell somebody that it's not okay, does that stop them from doing it? I don't think so. I mean, doctor's orders just don't work anymore. People don't follow them necessarily. It has to make sense to them, and you have to find ways to make it practical. So for that individual, identify the excess sugar, Try to incorporate more whole foods into your diet. Find one or two that will work for you, whether it's eggs in the morning for breakfast, or raw nuts and seeds for a snack, or any type of whole food that isn't something that has been refined carbohydrates, like breads and things like that. So, or reduce the amount of breads that you're eating. Start with that. One other very important thing that may be even more powerful than that is look at your window of eating. Time-restricted feeding last year became one of the biggest topics in helping people understand ways to control what's happening with your blood sugar. And what that means is you want to see if you can keep your eating window within 12 hours so that you have effectively 12 hours where you're not eating. It gives your body an opportunity to recover, repair, regenerate. If you're constantly eating, you're engaging insulin and you're creating this blood sugar situation. So you do want to give yourself a break. 12 hours has shown so many times alone to help people get better quicker. If you can reduce that down to a 10-hour window, let's say you stop eating at 7 o'clock at night and you don't eat again until 9 in the morning, you've actually increased that and you are definitely doing yourself a bigger favor. So do those 3 things to start. And if you have more questions specifically, this is your opportunity. Email me at info@strongandhealth. Say, Dustin, what about this? This is what I'm doing for breakfast, or this is what I'm trying for lunch, or what should I add, or what should I take away? Whenever I start working with somebody, I start with what they're already doing instead of saying, you need to eat all these things. I want to see, what are you eating now? And let's see what small changes we can take over time to get you there as quickly as possible, depending on where you're at. Everybody's different. And sometimes I forget that sometimes people don't realize that they're ingesting so much sugar on a daily basis or so many carbohydrates. You really want to focus on getting more healthy quality proteins and fats in your diet. And of course, you don't want to ignore the vegetables. I know nobody really likes to hear that, especially if you're eating to the point where you have developed these types of conditions. You're probably not eating a lot of vegetables, but find a vegetable or two that you do like and just make it a practice to get in there a little bit better. I usually start people out with a couple of easy ones at the top of the list and see which ones work for them. But please send me what you are eating and I will tell you what I would change about that if it were me and I were struggling with that condition. I hope that is a great beginning for you. If you need more information, I will definitely go into this next week to give you a little more, but you got to start small and go somewhere. Okay, so we got to remember that 93% of people could be effectively changing, and just by changing those 4 things, according to that EPIC study, it's a huge study, 43,000 people, and one was, of course, exercise, not smoking, reducing your BMI, and eating a whole food diet. So making sure that you're getting whole foods in there is a huge difference. Okay, I hope that helps, and I hope that gets you on the right path. We have a question coming in live on this. Okay. Yes, beans are high in carbohydrates. Thank you for mentioning that. However, they are a whole food, and I would prefer someone eating those over a processed, refined food because you're still getting the micronutrients that you need. In those processed, refined foods, if you're eating nothing but breads and biscuits and pancakes and things like that, there's not going to be any magnesium, there's not going to be any potassium, and there's not going to be any fiber. Fiber is incredibly important. Yes, it is a high carb food, but if we're looking for transitions and we're looking to get people away from highly refined micronutrient deserts of food, we want to start moving towards something that they will eat. It wouldn't be my number one choice. Of course, we do want to do that, but remember, baby steps, baby steps, baby steps. We have to get people in the direction and help them understand that there's a whole food situation that's important. And you cannot ignore the need for potassium and magnesium. They're absolutely essential, and you need a lot of them every day. Okay, 5 questions from Dr. Shipples. And I'm going to try to do something not boring, please. That was a request that we had. And in fact, I've been thinking about this, but I don't know if it's appropriate when it's attached to the next question. The question is, what will help with sex drive? Okay, there's a lot of things we could do to make this not boring, but I'm going to give you some honest answers actually about this. Number one, it depends on the person. There's two things I would start with. One is examining your testosterone. Testosterone is going to be a big part of that sex drive, and if that is something that you've been struggling with, or let's say if you were somebody who went to the hormone talk and you were somebody who was getting testosterone and was helping, that gives you a clue that it has to do with your body's ability to create its own testosterone, and I would focus on that. And so you want to focus on those things that are going to help you with that testosterone production, and exercise is going to be huge for that. And in fact, if you're working out with your partner, that would be a great idea to get your testosterone going and increase that sex drive together. So focusing on in supporting your body's ability to do that, there are a lot of things you can do to help support your endocrine system. There are herbs out there that can be very helpful. but it depends on what's going on with the individual. Sometimes people take tribulus, and tribulus is difficult because there's a lot of bad sources of it out there. If you get a good quality source of it, it can help your endocrine system, and it can help with that if everything else is healthy. But if those of you who were at that talk remember, in order to make testosterone, you have to have vitamin D. Remember, that is incredibly important, and so many people aren't getting enough vitamin D, so I would focus on my vitamin D as well. And of course, in order to make sure that your vitamin D levels are great, there's a huge magnesium component, so that goes back to making sure we have that magnesium. So a lot of these things, I know they get complicated, but when you're starting to approach it holistically and you're doing all of these things at once, all of the boats rise in the harbor. So focus on testosterone and exercise together specifically. Now, if you're still struggling and if you've already done those two things, let me know. We'll take it to the next level, and maybe we'll make it less boring next time too. Okay, how do you protect your bones from getting osteoporosis? I wanted to spend some time on osteoporosis because this is a great example of how holistic long-term care is so important, because this is something that happens very slowly over a very long period of time. And this is how most things are happening in the body, but people don't realize that if you're not being preventive, if you are not taking care now, it is something that will sneak up on you. And this is what they talk about, is something that sneaks up. And we think of it as just getting holes in your bones, actually losing calcium from the bones. But it's a little more complicated than that. It's not just about taking a calcium supplement. And in fact, there's been a lot of research out there showing, look, these people are taking these calcium supplements and it's not helping. There's so much more to that, because the calcium supplements that they're taking aren't quality calcium supplements, number one, and all of the other pieces that need to be there to help get that calcium into the bone aren't there. And that's why whole foods are so important. There's so much in the foods that we don't realize is even there that's helping us utilize the calcium. There are phosphatase enzymes that you have to have in order to make that happen for you. You have to have your vitamin K. You have to have, again, your vitamin D. So when it comes to osteoporosis, this is a really important understanding of a bigger scope and making sure you're getting all of these nutrients in there. So a little bit of everything all the time with an emphasis on what your weakness is. Now, if you're somebody who already has that, this is a point where you might want to be looking at your vitamin K, your vitamin D, a good quality whole food calcium source, and actually something that's going to have a little bit of phosphorus or the phosphatase enzymes to help out. Now, I know that's a little complicated, but if you have more specific concerns about that, I can talk to you a little more specifically about that. One thing that I thought was interesting is if you go to the National Osteoporosis Foundation's website, there's a huge list of things or conditions that could be contributing to it, because it's so broad spectrum. And almost every condition or disease is on there, including people who have eating disorders, including people who have had digestive problems. And so you have to think about the fact that if we're getting these nutrients in there, we want to be able to utilize them and get where they need to go. One thing I found very interesting and very important for everybody to take note is on their website, they have a massive list of medications that may be causing the bone loss. And on that list are going to be things like proton pump inhibitors, antacids, aluminum-containing antacids, things that are lowering your stomach acid. Because when you don't have that stomach acid, if you're even getting all of those nutrients that we discussed in there, you're not able to extract them and utilize them. So you have to have that. And remember, calcium is an acid buffer. So if you're taking it, it is going to lower the stomach acid even more. So you have to have really good stomach acid to make that happen. Other medications that are on that list are serotonin reuptake inhibitors. So antidepressant medications are on that list. Thyroid medication is on that list. So check that out. Understand that all of these have an effect long term, and that's the most important thing we're talking about here. We're trying to make people understand that the choices you're making today, if you get them as habits and you do them consistently supportive, these long-term conditions you're taking care of now, instead of waiting until it's 20 years too late and then you don't know what to do and you have to try to turn this Titanic around really quick and you capsize, right? We want to change the direction now so that we're going away from that iceberg now. Okay, osteoporosis is a really big question. If I have not fully answered that question for you, please let me know, and I'll be more than happy to get a little more detail. The more detail in the questions, the better, guys. That would be very helpful. Okay, endometriosis. If you have endometriosis, are you at risk for breast cancer? Should you get more mammograms? Okay, excellent question about breast cancer and endometriosis. And what we need to understand about endometriosis that may be associated with that is a lot of times endometriosis is the result of estrogen dominance. There's a huge correlation between estrogen dominance and endometriosis. And of course, there's also a huge correlation between estrogen dominance and breast cancer. 70% of all breast cancers are estrogen receptor positive breast cancers. So there is going to be, if it were me and I had endometriosis, I would definitely be examining my estrogen or making sure that I was doing what I could to reduce that. Number one thing that I would start doing is eating more cruciferous vegetables. That would be your broccoli, your kale, your Brussels sprouts, your cauliflower. A daily portion of those, absolutely, because you want to be clearing the excesses of the estrogen. That has to happen. I'll be very careful to make sure that the food I'm eating is organic for the reasons of the chemicals that are being sprayed on them can inhibit or kind of just mess up the whole endocrine function, and it can really cause problems there. So that would be another one. Cruciferous vegetables, I would be making sure that I was eating organic, and I'd also be mindful of my iodine intake. We do mention iodine a lot, not every week on here, but iodine can actually help with excess estrogen. So you're getting things from the sea. You want to make sure you're getting sea vegetables and seafood. So salmon would be a great source, cod, scallops is actually a pretty good source, and even shrimp. Now those are maybe not on the top list of perfect foods for everybody out there, but they would be a good source of iodine and a few other things that would be helpful too. When it comes to mammograms, now we've talked about this a few times before, and the research does not show that it actually helps at the end with mortality. I know that there's a lot of confusing information out there, and mammograms are not something that everybody is recommending out there, and I don't want to make a definite statement one way or the other about what everybody should do when it comes to that, but there are alternative ways to start making sure that you're checking to see if you are at risk for that, and I would encourage you to explore those. I would not say thermography is the number one or the only thing I would do. It may be something that can help with information, but then of course we did talk about the 3D ultrasound paired with that as a possibility. So just explore your options on that, and I would definitely look and talk to an expert in that field who is well versed in options to the mammogram, and anybody who says that the mammogram is the only thing and it's the gold standard, I would definitely encourage them to maybe look and do a little more research on what has come to light recently on that. So that's my whole answer about the mammograms. I could definitely go into that more if you want some more information on that next time. And finally, the last question is, how do you manage hormones post-failed fertility treatments? This is a tough one, and it's a very interesting question, and that can be very discouraging and very hard on people. But again, we have to think in terms of a holistic approach to the whole body. And if we're having an excess of hormones, we want to be supporting the hormones being able to naturally leave the body in the best possible way. And you really want to examine what is going on with you overall. And a lot of times, believe it or not, I'm finding when this is happening, there is a huge sugar component to that too. People are eating way too much sugar, and I know that it's strange to make that mental leap between sugar and fertility, but ultimately it can cause a real big problem for people along with the stress of their life, because you've got to remember, we've got the fight or flight, and you've got the rest and digest, or feed and breed. If this is way out of balance, this is going to be really hard to capture and get into. So we really have to focus on supporting the endocrine system, supporting the balance of the hormones, the removal of the excess hormones, and also just focusing on that adrenal health again. The adrenal thing was the thing I think I forgot to talk about when it came to testosterone. So we're wrapping it all the way back to the beginning and focusing on adrenal health. And we have a whole list of do's and don'ts of ways for lifestyle to help people with that. If you're interested in that, just let us know. Okay, that is all the questions. I hope those were sufficiently answered for you. And again, if they're not, please give a little more detail, and I'll most certainly get into it in a little more detail. Keep the questions coming. We have a lot, but I'm trying to keep these shorter and making sure that we're giving you the most impact in the shortest amount of time. Thanks for watching, guys. If any of this was helpful or interesting and you want to share with your friends, we'd really appreciate it. It makes it easier for us when you're sharing this so that we can get everybody on the same level of knowledge so that we can keep moving up with the knowledge that we have, as opposed to just having to repeat lessons that we all realize become something that just makes sense to all of us. And I want it to make sense to all of you, so if it's not making sense, please let me know. We'll make sure we clarify. Have a great week and stay healthy.